Welcome, welcome, welcome to Health Issues. I'm your host, Chris Sylvain, and we're thoroughly excited about today's show. We're come to speak about, there's a specific report that was brought to light, and the press conference was this past Tuesday, and really the writer of the report is Mr. Ali Bustamante. He's an economic policy specialist, the Jesuit Social Research Institute, and it's really an awesome report that was given. And right along with him, we have Dr. Elmore Rigamer. He's a medical director for Catholic Charities, Archdiocese of New Orleans. Welcome, Dr. Rigamer and Mr. Bustamante.
Thank you for inviting me.
Hey, a pleasure having you both. And let's give us a little overview of kind of where we at, Mr. Bustamante, about the report.
So we basically start from the perspective of what would the budget look like for a family to obtain a modest but dignified standard of living in Louisiana and also in its different major cities such as New Orleans. And we basically find that the dollar figures tends to be for a married couple family with two children about $62,000 a year. And there's a lot of families that we find that aren't meeting these standards. In fact, when we look at families with children, about 52% of just families with children aren't meeting the estimates that we create in our report.
Well, this report mainly deals with how much it costs to live in the city of New Orleans specifically then.
That's right. So we do a big focus for the city of New Orleans just because we find that it actually does have the greatest living expense among the major cities within Louisiana.
So how much did you say somebody would have to make?
Yeah, so we're actually looking for a married couple family with two children, about $62,000.
A married couple, $62,000
a year, that's right.
A year to be able to do what?
To able to obtain what we call a modest but dignified standard of living, which means being more than one step away from economic deprivation that we know as poverty, homelessness, and untreated physical mental illness.
So in New Orleans, unless a family of three are making $62,000 a year, then they are living probably kind of burning a candle at both ends, really can't put it together.
That's right. You know, we find that without reaching these estimated figures that we create in our report, chances are something's got to give, you know, within their budgets, whether it's housing, whether it's healthcare needs, whether it's the quality of food. And, you know, in order to create these estimates, we really do look at low-cost options for housing, for food. For example, when we look at food, we look at just low-cost food option plans designed by the United States Department of Agriculture that basically looks at people buying food at the grocery store and cooking it at home, so not eating out or anything like that. We look at the 40th percentile of rents within New Orleans. We also look at the 25th percentile of health insurance premiums, as well as the out-of-pocket cost for this 25th percentile. So all these estimates really provide us with a conservative estimate of what it costs to live in New Orleans in particular.
That's not being rich, that's just barely making it.
That's right.
Barely making it. And Dr. Rigamer, as a medical director of Catholic Charities, you get to see everything firsthand.
I don't know what you mean by everything. We get to see a lot, but let me pick up on what Ali just said, is that healthcare is a big expense. Healthcare, incidentally, is the reason why, the number one reason why people in this country go bankrupt. Medical bankruptcy is the number one reason for bankruptcy. Mm-hmm. So if we take the family that he describes and someone gets sick and they're not able to get good health care, you can see a sequence of events, unfortunately predictable. They can't work. If they can't work, after they run out of sick days and unemployment benefits, very often, because they're living so close to the line, they may lose their home. And so healthcare is essential. Not only you got to be healthy to work, you need a healthy workforce, you need a healthy, educated workforce. But if you lose it and you're this close to the line, that's when we see really the ravages of poverty, homelessness, children living in shelters, and illnesses untreated, and particularly in our population. People have, many of us have not the healthiest lifestyle. Right. So diabetes and high blood pressure and obesity and lung disease, those are the kinds of problems we're talking about, and they hit quick and severe.
So it affects everybody?
It affects everybody, and if it's the Usually these families that he's describing, usually both people are working, sometimes 3 jobs or 4 jobs among 2. And if you lose one income, again, with no big safety net, you're close to the margin, the 4 people are in trouble, the prototypical 2 children and the parents.
I find the approach interesting because particularly your training is as a psychiatrist.
I practice as a psychiatrist in the Daughters of Charities clinic 2 days a week, but for years I've been medical director of various programs.
Okay.
And this one is one of the most exciting ones I've done. It's Mr. Bustamante invited us to present at the Social Justice Research Institute Tuesday because we see that a lot of people in New Orleans who do not have health insurance, and we have quite a few in New Orleans who do not, they go to the emergency room for care. And it's expensive care. They may not be able to pay for it. And it's not the best care if you have chronic illnesses and you got to learn about your illness and learn how to take care of yourself. But they go because they can't get into a clinic. They have a hard time getting into a clinic, and they may not be able to buy medication. And sometimes they get medication in the emergency room.
A tragedy.
It's lamentable. Yes,
definitely. Now, Mr. Bustamante. Now, you mentioned the figures you used was for a married family of 2 of 3.
We actually look at different family types. We look at single mother families, we look at single father families, as well as married couple families. By and large, it's really the single parent households, particularly single mother families, who have the hardest time reaching the kinds of incomes necessary to survive, and particularly to obtain the kinds of economic standards that we put forth in our report.
Okay, and your background as an economist from Miami, University of Miami, we're proud to say. So looking at this, most families fit in the single-parent family.
In terms of the ones that find the most hardships, and particularly the ones that fall below our measures, they tend to be single mother families, in fact. So out of the more than 250,000 families in Louisiana as a whole that fall under our measures, about half of those tend to be single mother families. And the reason for that is their costs are the same as a married couple families. The only, but really through usually no fault of their own, they just lack an additional income source.
Now, are there that many, percentage-wise, not exact numbers, but it appears that married couples usually don't fall in that category as much when people stay married. Is that the general?
That's absolutely true. However, they're still not necessarily immune to it. So we see that about 1 in 3 married couple families do have economic hardships. However, when it comes to single mother families, we see that 4 out of 5 have hardships.
80-some-odd percent.
80.4% in fact.
And that's what we see in the people that this program that we have called Health Guardians. We go to the emergency room and we screen for people who go there frequently or who are hospitalized frequently, knowing that they better taken care of in a clinic. And fortunately now we have a lot of clinics in New Orleans, and we register them in a clinic. And a lot of the people we see fall into the categories that he mentioned. They fell through the safety net. Most are single families.
Mother trying to put it together with kids.
Correct. Or a father who was a father somehow. The stresses that Ali is describing really tear up a family, and so often if they were a traditional family, the father may have left. Embarrassment, stress, losing the job, not being able to support the family. So we see a lot of men who have had families, but now are living alone or sometimes are homeless.
Wow. Yeah, we see all across the spectrum. Now, what prompted the generation of this report to make this happen? Because you're new to New Orleans, am I right?
Absolutely, yes. Just fresh from Miami. I just brought my family over in July. Thanks to a generous grant from the W.K. Kellogg Foundation, we were actually able to start a series of reports, this being the first that actually looks at economic security here in New Orleans as well as in the greater Louisiana and Mississippi areas.
Okay, and but it's through Jesuit, the university, Jesuit, the Social Research Institute itself. Is that the driver?
Absolutely. Being part of the Jesuit Social Research Institute, we have a focus on racism, poverty, as well as migration, and we basically find that one of the overarching issues that really governs these three different focuses for us is economic security. Economic security is really one of the underlying things that ties how well families are doing and how well our society is doing.
You find that this, from a psychiatrist standpoint, I guess from the medical standpoint, you find that also where, is it that some families can handle the poverty and other families can't?
Yes, I think some families are better at handling these stressors than others, but almost all of them, when the two stressors are more than double the effect,
Okay.
And so when a lot of things hit them at the same time, it's very difficult for a family to get through that.
Okay.
Very difficult. And again, my focus is on healthcare, but I think the education and the healthcare go hand in hand. If they are educated, they're more likely to have a better job and more likely to afford health insurance. Not necessarily, but if they don't have good health and they don't have access to good health, that's the big stressor that starts this negative train of events.
So if they have good health care, let's assume if all other variables may change, but if the health care situation, I guess that's the thing, if they're able to get preventative care and education about proper nutrition and those things.
Exactly. That's, I would say, the chances of their going into poverty, even with the families that you're studying, are lessened considerably if they have good health care. And they're not going into debt because of health care. So even people with insurance policies may not be able to afford some of the stiff copays or deductibles, or they may not be able to get some of their medication. So there is health care and there's health care. But if they got a good policy and allows them access, like you say, preventive medicine, treatment for acute diseases, education, medicine when they need it, behavioral health, that is a big protective factor.
Could it hold families together, even though they may be housing may be a problem, food may be an issue, all those other things may be challenged, but if there's good social services, people that they can meet with, if they're going through stresses, social workers, psychiatrists, and so forth, would that be able to
I think it would be a big help. I think it would mitigate the effects of the other stressors. But if you're not healthy, and you're really feeling bad, all these other things are hard to do.
And it's especially difficult to make a living and make the kinds of incomes necessary to provide for your family when you don't have health.
Right. And it's not uncommon that we'll see someone who has had a family and had a decent job, and something happens, and the person gets sick, for example, and that's not uncommon. And many people in our city, as you know, are uninsured. 25% are uninsured. And so then the problems start to build on each other. And that's what puts a lot of stress on the family. And ultimately, if the person loses his job, even with two incomes, if there's one lost income, then there are bad things that begin to happen.
Okay, well, let me ask this, just to get a scope on the city of New Orleans. That figure you mentioned, about $60,000 a year, not that many people make that.
That's absolutely true. And again, when we look at just even the figures for the entire state, you're looking at about 52% of all families with children who don't make these kinds of the incomes that we actually recommend that they should be making. And
that's all families.
That's all families.
If you take into account all families.
Yeah.
So the distribution.
The distribution, yeah. So you're talking about just again, it's something that is very common among our communities. One of the things that we know as well is that the prevalence of these families lacking this economic security measures that we put forth in our report also has a lot of implications for our communities, because we're talking about greater economic burdens in our community, burdens on on the request for social services, but also on the general economy. Again, if people aren't necessarily meeting their basic needs, what does that mean for their employment possibilities? What does it mean for their possibilities of getting education and so on?
Well, I don't think you sliced it by neighborhood, but I think it's safe to say we have some neighborhoods where we wouldn't have anybody in there.
Do you have it by zip code?
No, we do not. We do have it by major cities. If you were to look at, absolutely, if you were to look at zip codes or particularly U.S. Census tracts, I mean, there would be some that would just light up. We know what our communities look like in terms of just, navigating through them, walking, whether you walk or drive to work, whether you go to the grocery store. However, we would argue that all communities, irrespective of their wealth and how diverse they all have some skin in the game in order to make sure that all families achieve these standards, because ultimately all communities are tied to our overall state economy, and it's really the fact that families can't make their basic needs that ultimately may create a lot of burdens for our economy, particularly in terms of decreased spending that goes to our communities and particularly to businesses in our community.
And we have some analysis by zip codes of people that we meet in the emergency room who are going there. Most of them don't have health insurance, and there is a concentration of these people in poor neighborhoods, as you would expect. In Central City and the 9th Ward, we see a lot of patients from those zip codes. So we do analyze where they're coming from by zip codes.
Wow, and that's interesting because as this research, I could see it going on. You can look at educational levels. You can look at literally probably all of the different parameters to get not predict, but have an idea what's going on.
Well, you can predict you can predict a lot by the zip code you were born into.
Okay. Pure and simple. I mean, the data is the data.
Yes,
so there's nothing you can do about the data.
So because of all the implications that he's talking about of what goes on in that zip code when families live below an economic level that grants them a safety net and a dignified lifestyle.
Okay.
And we don't have many in those zip codes.
Pure and simple.
Absolutely true. And it's really a vicious cycle for a lot of families, just because if they did have those higher incomes, which first off can come in one of two ways: one, greater compensation, but also greater benefits. As Dr. Rigamer mentioned, if a lot of families were to have good health insurance from their employer, first of all, health insurance period, but particularly good health insurance coverage from their employers, that would be a huge cost that would be minimized in their budgets.
Yeah, and in other countries, in other Western industrialized countries, there's not an issue about not having access to health care or not having health insurance. Everyone has health insurance. It's only in this country that we see health insurance as a market good. If you can afford it, you get it, like buying a tomato or a Mercedes. It's not a right where you should have health care like you have education and security and clean air. It's not like that here.
When if we look at it, how it affects, say if we look at it, like you said, skin in the game, how it affects everybody else in the country. If we're going to put dollar for dollar, probably the most powerful dollar to place in is for health care before anything else.
To me, it would be neck and neck education and health care.
Neck and neck, you think?
Yeah, I would say neck and neck as well, because both of them have severe implications in terms of making money, having proper wages and having the incomes necessary to provide for your family. Education, we know for a fact that the more education you have, the higher your income will be. Okay. I mean, there's
and then in this system you can afford health insurance.
And exactly, and oftentimes higher education leads to better professions. That those better professions tend to have higher rates of insurance coverage. So those things go hand in hand. But in terms of even just getting education, getting to school in the first place, you have to be healthy in order to qualify for jobs and to stay at those jobs. You have to be healthy. If you don't show up to work for a couple of days because you caught the flu and you're at home bedridden because you can't afford the proper medicine to take care of that, you might get laid off. So these two things really go hand in hand.
Yeah, it is, yeah. And in the service industry here in New Orleans, generally low-paying jobs, often without benefits. I don't know how many of them have sick leave or whatnot, or paid sick leave, but it's hard when you have a low-paying job and you don't have enough sick leave to get to the doctor because clinics are open during the day. It's another reason why people go to the emergency room at night. Or if you get sick, it's unlikely that you're going to get paid while you're sick, or it's not going to be for a long period of time. So there's not that cushion. It doesn't give you the resilience. It doesn't give this person the resiliency that we have, who have good jobs and have health insurance and are educated. So a simple illness just snowballs, into something that it needn't be because of lack of timely access to quality care.
Throw those figures out again. The 68,000 for a that's.
You're surprised by that. Huh?
Yeah, I am. The dollars are astounding to me because 68,000. That's about like $20 an hour.
That's right. That's what it would be.
And you know, the one thing to keep in mind is that it doesn't necessarily mean that a person has to make $15, $20 an hour. It would be ideal if they could. However, an alternative would be them getting the proper health care, so that's a lower expense for them. Another idea would be for them to get, perhaps child care subsidies from their employer, or family leave. These kind of benefits. These kind of benefits would lower down the cost for child care. These kind of benefits would lower down their overall health care costs. It's really, there's no one policy that has to go in place to correct the real precarious situation a lot of families are living in. There's a lot that can happen, both from the private sector in terms of businesses and their wages and benefits that they currently give, as well as the different protections that our state and government can give us. One clear case, for example, would be Medicaid expansion. There's a lot of people who live above the poverty line who don't have health care coverage.
Yes.
And Medicaid expansion would be one of those things that, first off, it's largely federally funded, the Affordable Care Act that is, that would bring subsidized and often very, very low-cost health care to
270,000 people in the state.
Exactly.
Wow. So that would drop to $20 an hour. That could drop it to 15 right there.
Absolutely.
Yes. If you in the ideal world, as in other Western countries, industrialized countries, healthcare is not an issue. One doesn't think of it because it's there. Mm-hmm. Here, where you have to take part of that $62,000 to pay for a healthcare premium, and it's probably the low end of a healthcare
Absolutely.
premium.
Yeah, we're looking at the 25th percentile for one employer-sponsored healthcare premiums, which tend to be considerably cheaper than individual healthcare plans, as well as out-of-pocket expenses.
So when you buy that plan, you're going to have greater out-of-pocket expenses. Mm-hmm. But it doesn't have to be this way. The way we spend money on healthcare in this country, if we just reorganized the system and did it differently, it would not cost any more than what we're spending now to have everyone in this country have trouble-free healthcare insurance, like Medicare.
Like Medicare.
It's Medicare
just
for
like
all.
Medicare.
It's like Medicare for all.
Pure and simple. And again, if people are healthy, then the teachers are saying, hey, send these kids healthy and I can do a whole lot more with them.
Right. I have children that have to take medicine before they go to school, and they have to take it with breakfast. Mm-hmm. And I'll have a mother look puzzled when I say this. And she says, well, he doesn't get breakfast till he goes to school.
Wow.
And weekends and holidays and summer times are a problem because he doesn't get breakfast.
All right.
Except at school.
Okay. And I'm going to go back again. I'm with you. The lowest number for an individual is about $40,000 a year.
And we actually, in this particular study, we focus on families with children, just because we really think that those are the most important. When we think of the individual hardships that a lot of people face, they can be very diverse. But when we think of the families with children and their hardships and what it really means for our communities and our society to have families with children, whether again they're single mother families or whether they're married couple families, there is a lot to be said with how well our families are doing in our society in terms of how that reflects our responsibilities to them.
Okay, good. That makes sense. Well, you can see right away that Section 8 housing, because I think your figure for housing started at about $900 a month, right?
Yes, absolutely. Yeah, we look at the 40th percentile of rents for housing provided by HUD, which it's not the lowest cost option for housing, but it is a low cost option that guarantees broad access for people to be able to. So that figure of $900 is a realistic figure that we believe that families can go out there and find that $900 2-bedroom apartment, for example.
$900. Yeah, I think it's not too much. It's no more $300 or $400.
No, and that's one of the things that we know, particularly post-Katrina, in terms of the scarcity of housing in New Orleans, that those $300, $400 apartments just, if they do exist at all, they're few and far between, and very most likely there wouldn't be very good quality housing.
powerful. Okay, let's flip it around if we can. To a taxpayer sitting at home, what could they do? I know the report doesn't deal with it specifically, but if they're looking at, hey, I want to help this situation, what does it seem like the way taxpayers should start looking at it to call their representative?
Sure. So, I mean, first and foremost, you know, individuals should push their legislators as well as their employers to have policies that support families. That's what one of the things that we generally broadly feel. But additionally, one of the things that taxpayers in particular should know is that if families have greater incomes, you know, if families have a better capacity at meeting their basic needs, it also means our economy is going to be doing a lot better. For one thing, if we have higher incomes, we're going to have higher spending. That higher spending usually translates to greater state tax revenues that are generated from higher payroll, higher revenues coming from payroll taxes as well as sales tax. Mm-hmm. That means that those are taxes that are going to help our state legislator provide more services and maintain the current infrastructure that we currently have. It also means that we're going to have a healthier workforce. It also means that we're going to have a workforce that will be able to be more competent and more effective at their jobs.
Question, Dr. Rigamer. Does healthcare alone create desire to work harder and make better grades?
No, probably not, but not the healthcare alone, no. I mean, you have a lot of healthy people who don't work or don't make good grades. But I think it's very hard to work hard and make good grades if you're hungry and you're sick. You know, to go back, we have a lot of people in the city with diabetes, and that's a difficult disease to control because it requires medicine, it requires diet, and it requires a knowledge and a discipline of how you should live. And we have a lot of people that are not able to do that. They can't avail themselves of the wherewithal, the resources to get all that done. So no, healthcare alone is not enough. It's necessary, but it's not sufficient.
Okay, but the drive for this study is because I care. You know, you guys care about those, and I keep flipping back to the concept of personal responsibility. Yeah. The necessity of those families. Absolutely. Would say, hey, you know, in other words, let's take the numbers around. If somebody's getting Section 8 housing and they're getting Medicaid and they're getting those things, it's pretty difficult for an employer to compete with that. We got to run. Okay. Health issues, fight as hard as you can. We have to do part 2. Thank you so much. Awesome. Thank you. Awesome.